All right, hello. It's good to be here again for another session of our lecture series. And I want to thank everybody that has made our time to be here this evening to be part of today's lecture series. It's a privilege for me once again to host this lecture. And I'm really grateful that you've made out time out of your busy schedule to be here today. Today we're going to be looking at a very important topic that we have titled Opportunities for Medical Doctors in Nigeria. We know that in Nigeria we are bleeding doctors. And by that I mean that there is a serious Japa syndrome that is going on in the country. Many doctors are emigrating, leaving the country to find greener pastures elsewhere. And even on this platform, we've taken time to look at immigration, how it's affecting us, and the opportunities for immigration. And we've looked at those topical topics very intensively. But we felt that it's a time for us to also look inwards, look into our own country, Nigeria. And we asked the question, is all hope lost for medical doctors in Nigeria? And because on our platform, we have so many young doctors that are looking at trying to, ascertain what their future as medical doctors in Nigeria will be. Is there really hope for them, or should they be looking out to go as many other people have gone? And, it's a question that begs answering. Is there hope for medical doctors in Nigeria? And that is the question that we want to answer today. And to answer that question is no other person than a very senior friend, Dr. Chinedu Obikili. He's someone that I have admired and respected for a very long time. So I'll just take 1 minute to introduce him and hand over the stage to him to give us his thoughts on opportunities for medical doctors in Nigeria. All right, so Dr. Chinedu Obikili is a medical doctor who has a beating heart for Nigeria. He graduated from the University of Jos, and that's where he got his MBBS from. And he's a fellow of the West African College of Surgeons and also a fellow of the Medical College of Obstetrics and Gynecology. He also holds a master's degree in public health from the prestigious Ahmadu Bello University in Zaria. All right. And he currently works as a maternal health specialist with Solina Center for International Development and Research. He's married to his beautiful wife, and I think they have 2 children. I don't know if he has added a third, but I'm aware that he has 2 children as at the last time I checked. He's a very versatile doctor, very intelligent person, and he's one person that, like I said, inspires me with his dedication to work, he's a stickler for principles, and he has a vision and a heart for healthcare development in Nigeria and beyond. So this evening, ladies and gentlemen, help me welcome Dr. Chinedu Obikili. And before I hand over the stage to him, I also want to acknowledge that there are many other persons, very senior persons on this Zoom call that are not just young medical doctors, but also seasoned medical doctors and even professors. I don't want to call any names, but I see you and I recognize you, especially everyone. Thank you so much for being here. So, Dr. Obikili, I would hand over the stage to you, sir. Thank you so much. Please go ahead and share your screen, sir.
All right. Thank you very much, Samuelson, for the kind introduction. So I will commence to share my screen now. And then I think while I'm doing that, yes, Samuelson, you mentioned I have some, well, I would say, yes, a very senior colleague present. So what I'd ask first, Samuelson, is that if you can maybe reach out, while we're having this conversation and see whether she might be willing to say a word or two maybe at the end, because I'm sure there will be lots of additional insights and perspectives from her. So if that's
All
possible,
right.
you can maybe do that towards the end and then let's see. But if not, of course, we'll just
I'll
go
do
ahead and
that,
have
sir.
the
Thank you.
conversation. Yeah, thank you. Yeah, so I think this should not be a very long conversation. First thing is thank you very much to the Bingham University Alumni Association. I think I've met a number of Bingham students, both in my past work and where I'm working presently. And I think the quality of the personnel that I've met have been really good ambassadors. And so when I see people from Bingham, I tend to be very, very pleased. It almost feels like one of our own, we who finished from the University of Jos. So thank you for considering me worthy to have this discussion, and thank you all for taking out the time to join us today. So I'll just jump right into the conversation. I think ultimately what we are trying to speak about is looking at the opportunities for medical doctors in Nigeria. I think let me stop sharing and reshare because I think the slide wasn't moving when I attempted to move it. So let me see how I can sort that out. Maybe I'll just share my entire screen. Okay, so can we confirm that we are on the outline now?
Yes,
Yes,
we
sir.
are.
Well, yeah.
Okay, perfect then. All right. So I think we'll just basically how I try to approach this conversation is just I heard that Samuelson had mentioned that the team here has had a talk before about the opportunities out of the country. What I generally say is that there is no right choice or there is no wrong choice. I wouldn't tell people not to Japa, and at the same time, I wouldn't tell people not to stay. It's about evaluating personal preferences, and I think one thing that most of us would agree on is that what is most important is to make an informed decision, because a lot of the time people who live sometimes live under the pressure of everyone is leaving, and then they make you feel as if you're trying to stay there must be something wrong with you. One thing that they were always telling us during residency is that before you japa, at least travel and see what it's like, because both sides have their own issues, and there's no perfect location. So I just take it through the initial choice that we make, and then what I consider the never do, and then list out the options, that I'm aware of, and then we'll talk about like some emerging options, because it's good to always keep an open mind and have some sense of diversity and creativity, and then mention a few key decision factors, and then just speak about how I made my own decisions, and then where I am today, basically. And I guess we can take some questions and answers. I think if at any point in time there are any questions, you can feel free to drop them in the chat box, and then at the end of the discussion, maybe we can try to address them and maybe have others contribute as well. So I think, like I said initially, the first thing is that first decision, which is stay versus leave. I think for me, from close to final year, I started trying to have conversations with seniors, particularly those who stayed and then those who left, so get their perspective, because like they say, there's nothing new under the sun. There was a first wave of Japa that occurred somewhere around the 80s and 90s. And so it's not new. Interestingly, it was under a similar disposition, in the country that wave took place, if you remember, around the 80s. And so if you want to have an idea, about what the outcomes could be, that set of people who Japan in the 80s and 90s, they are still very much alive. So if you know some older people, feel free to have conversations with them. I had uncles and aunts as well as parents that were on both sides, lots of senior colleagues, and then I had a lot of conversations with them, to know what they think about it. It's important to understand the Nigerian situation. Now, the way I see Nigeria is that things are very hard currently. They are ridiculously hard. And I can't even imagine how people are trying to get by now on a resident salary. But we need to understand that where there was a very significant depression, economic depression, and generally these things happen in waves. And I mean, from my understanding, there's already some sense of stability and there's potential for economic recovery. Those who left in the first wave of the Japa, the left, and of course, naturally, you first start getting a lot more money. But people who are able to weather the storm, eventually, a number of them were able to get by and had a very decent life within the country. And so, one thing we need to discard is that if you're thinking about staying, you need to mentally take away the fact that, or feel like it's unwise or absurd for you to stay, because people ask you, what's wrong with you? How can you be trying to stay in this country? Are you crazy? Like, they make you feel like you're a mad person, basically. And another thing that's important to think about is short term versus long term. Like I said, when you leave, instantly you start making a lot more money, instantly. But sometimes when you look at it 15 years, 20 years down the line, you now see that the differences, you now see that it shifts, because externally your salary might not significantly climb, but when you rise up in the Nigerian system, you can then get to a place where you're quite comfortable, and also it's easier to like set up businesses and other things aside like just the pure practice in Nigeria. And it's kind of easier to blow, basically, and just be swimming in millions. There you just fit into the cog well. And then, of course, it's always important to put a mental calculation of salary versus cost of living, because, of course, when you say, oh, you're earning £3,000 or £4,000, and you convert it to naira, it looks so massive. And then you hear that tax is £1,000 and rent is £1,000, and then suddenly, you get there and you now start to think about, that money sounded big, but now this rent I'm paying, and then, bills never end outside, even for your car, for your TV, for everything. So sometimes by the time you finish paying all your bills, you look at what's left, you will then be surprised. But there are some viable options. UK is one of the commonest. Canada is now quite more often thought of. The US is probably the most desired and the most lucrative, but it's kind of difficult to get into. Other places in Europe and Australia are also there. And then one thing I would say, even for those who are thinking about leaving, remember that there's still Africa. So the thing about Africa is that there are opportunities in Africa. It's a little bit difficult for them to compete with the West. So they struggle a little bit to be able to pay and get doctors, but they also have a lack, and there are also opportunities there to thrive. So it's always important to keep that at the back of our minds. Then there are some pluses, of course, in the JAPA side, satisfaction of practice in a functional environment. People don't want to be chasing blood or looking for syringe or having patients who cannot pay. So working in a functional environment tends to have its own satisfaction. Like I said, there are two sides to the coin, basically. And then there's also the satisfaction of living in a functional society. So where SARS is not harassing you, you don't have road safety trying to taxi or police harassing you on the road, you're not having to pay bribe everywhere. So there's a lot to consider, and there are a lot of advantages on that side as well. And then, of course, we always need to remember that what I typically say, that this life is short, isn't it? We are here, it's a journey, and ultimately, a number of people are looking for some sense of fulfillment as well. So it's also okay to ask yourself what you want to do with your life, what you think about when you're 70 and 80 and look back, and the kind of, will you be satisfied with some of the decisions that you made, or how you lived your life, or the impact that you've had, in the world. People don't like to hear certain things, but one thing I always think about, and it's a reality, is that our education, Nigeria educated us for what is a ridiculously subsidized amount of money. And even though we feel like it's an entitlement, the design is that the country provided this education for us to function in society. Now, there are two sides of it, of course, because Nigeria does not create an environment for us to thrive sometimes. And so some of us feel, oh, even though they trained us for next to nothing, but I don't owe the country anything. And of course, they cannot trap us here, because that's like some kind of human right abuse. So, like I said earlier, there's no right choice. It's all about preference. And like medicine, what's important is making an informed decision. And that's the most important thing. So just understand what both sides represent. Now, I'll start with the first thing. Now, the one thing I'd always advise young doctors to do is never not do anything. Don't stay as what is termed a chronic medical officer, where you're not going in any direction. The one thing I've observed that in medical school, your parents have you've gotten admission, you've written your post-UME, and then oh, there's test next Saturday, there is exam after 6 months, and then you have second MB, you have third MB, you have O&G pediatrics, you have medicine and surgery. There are so many exams, and then so you're always preparing for the next exam. when you've finished, there's nothing pushing you. You have to push yourself. No one's going to, there's nobody that tells you primaries is next week, you must write it. So you have to then make that decision to move forward. And it's important that from the point where you finish medical school, even before you finish, you have a sense of direction and you start working towards it instantly. Because once you sit back and just allow the months and years start to roll by, then that's where you now get stagnated and it now becomes, and the longer you stay outside of progression, the more difficult it is for you to get back. And also, whilst we are working towards something, it's always good to have like some kind of plan B, because don't always, put all your eggs in one basket. So sometimes things don't always work out exactly how they desire. Now that the UK is a little more difficult, lots of people are looking for jobs and not getting them. And I've seen a number of them that have just entered residency because they wrote primaries at a point in time. So they started their residency, and then some of them are even somewhat satisfied with it and moving forward. And of course, it's still useful. So it's always good to have a plan B. And then one other thing is to stay flexible, because now in all different options that we speak about, there's always a potential to or opportunity to transition from one thing to another. So I know, like for pediatrics, for example, even after the fellowship, they can even transition to a degree to the United Kingdom as a fellow. You can always move from one party to another. So there's no one size fits all. Some people enter public health once they finish medical school. Some finish residency and then enter public health. Some from public health, they come back and do residency. So there's always opportunity to transition. And I would say do not spend more than half job year recovering from medical school. Because sometimes when you look at that result and see pass and qualified, you're so elated and you feel as if I don't want to write any exam again, I don't want to do anything again. Yes, that's fine. So enjoy house job, but latest by the end of house job, you should start working towards whatever direction you want to go. And the call out here says, if you're the first doctor in your village, well, that's wonderful. I'm happy for you. But now, be the next first thing. So move on, be the first consultant, the first professor, the first, head of an international organization. So I'll start with the options basically. So the one thing I'd always say is that doctors need to remember that first you're a graduate. So you don't always have to stay in the medical field. You're a graduate and you can compete for any job anywhere. You want to enter banking, you want to do graphic design, you want to learn UI, UX and software programming, you want to enter the movie industry, you want to sing, you want to enter a tech company, you decide you want to leave medicine entirely, you want to trade, you want to be importing from China, you want to go into oil and gas, you want to farm. These are all viable options. And you have your MBBS, but first year. So you've gotten that university education, you have your degree, but always remember you can still do anything that you want to do in life, even outside medicine. However, medicine likely represents your best bet because you already have a bit of a niche. So if you're going elsewhere, of course, you're competing with a whole group of people in that field. I mean, going to banking, you're competing with everybody. So it's a little more difficult, but remember, you can still pursue that. I've known a number of who have gone into different sectors and then they're thriving. Because the one thing about doctors on average really is that doctors tend to be somewhat smarter than most of the other graduates. And so wherever they go, they have a tendency to thrive. When we are competing with each other, locally, sometimes it feels as if, you don't know much or you're dull or, you're not high up there. But when you go elsewhere, you find out that you're just excelling. And so even while competing in those other fields, there's always a tendency for doctors to be able to do well there. And so some people who went into medicine because their father said, oh, you must be a doctor. Well, remember that your dreams are not dead. Whatever passion you have, you can still decide to pursue it, and that's perfectly fine. So now we'll just go right into the different options, and I'll just speak about how, the different pathways there, basically. And so one of the commonest directions is residency, and it's still a very valid option. The one thing about residency is that it gives you an additional niche. So you can what do you call it? You can still diversify to any other area you want to. But when you now diversify, you're an expert in something, and then that gives you that extra opportunity. And one thing that sometimes people look at residents and feel, oh, I cannot do this, because they see one junior resident with his rugged word coat and they are percussing him and he's not moving stuff and doing call every 4 days, and it just feels like hell, But I always tell people that on average, you finish medical school, let's say you finish at 25 or 27, if you finish at 25, retirement is somewhere around 65. So that's 40 years of practice, right? And junior residency, which is that part that looks really scary, is 3 years. So when you conceptualize it and you realize that this is 3 years out of a 40-year career. So even if it feels horrible, it's 3 years. So you can probably bear the 3 years. And then afterwards, you're a senior resident, life gets better as a senior resident, And then 6 years, you then have maybe about 31 years left in your career. And so at that point, you can do whatever. So even the entire residency takes about 6 years on average. So when you think about, don't let the junior resident that looks like a mess scare you from residency. It will pass. It's just a short time. And like I said, entry to any other direction comes with its specs and comes at a certain entry level. Because most of the time, as a consultant or as a fellow, wherever you're going, you're not going to be going starting at entry level. You start at a certain level, a little bit above, where entry level is. And of course, it's still the major acknowledged upgrade to MBBS in the field of medicine. And so generally, that just puts you at a level slightly higher. And for those who might not know the process, typically after medical school, you do your house job for 1 year, your NYC for 1 year, and your primaries can be done at any point in time during house job. But I think some of the colleges now are leaning towards having the primaries after house job. Then, like I mentioned, junior residency for 3 years, then you write your part one, which is your membership examination. Just to know that it varies by specialty. Not all specialties are 3 years, so there are some slight difference, but on average, about 3 years. Then a senior residency about 3 years as well, and then you have your part two fellowship exam. Some faculties then have like a bit of a subspecialty training, some about a year, some up to 2 years. So there's also that as well. So that's just the general process. Now, one of the things about doing residency is that you also have to think about what do you want to specialize in, and there are certain factors you can keep at the back of your mind. Of course, there are personal preferences. You've gone through medical school, you've done house jobs, so you have an idea the things that you like and the things that you don't like. Those like myself who couldn't start moving plenty deep stuff. O&G was fairly simple. So I said, well, I cannot enter internal medicine where everything is so complicated. Let me go to a place that is fairly easy to understand so that I can grasp it easily. Some people say they don't like blood, that they cannot do surgery. Some say they cannot be in labor and they cannot have lipo. So know your personal preference and that can guide your choices. Also look at your skills and ability, and then importantly, work-life balance, because some specialties require you to stay at night for calls. In some cases, like pathology, for instance, you might never need to sleep in the hospital for any reason. So you can look at some of those things. Those are factors for work-life balance. Particularly those who are thinking of starting families, it can also affect your availability with your family and things of that sort. So it's important to keep that at the back of our minds. Then, of course, job security. And these are in two directions. There are some uncommon specialties that you're almost certain you will secure like a federal government job because they don't even have enough of them. Like maybe I'll say dermatology, for example. I don't know how many dermatologists we have. So there's that security of, that you're likely going to get a secure job from this specialty. Whilst in O&G, almost all the teaching hospitals are filled with obstetricians and gynecologists. So you might not be able to find a government job. Of course, there's also private sector as well. And then financial prospects, I think we'll speak a little bit more on that in the next few slides. Importantly to note is that so there's a variation in private practice opportunities when it comes to different specialties. In the government, the pay is basically equal, at least at this time. And it's good to have an idea of the end goal within the specialty, like where you want to go with it. And most of them have more than meets the eye. I have colleagues who I wouldn't imagine that ENT would be like a really hot specialty that can have a lot of financial rewards. But then you come to Abuja and you find that they don't how many of them are even around, and then they are so much in demand and everybody's looking for them and looking for an ENT. And I was like, oh, that's interesting, because I wouldn't have thought that there'd be a lot of opportunities. So there's usually more than meets the eye in some of these specialties. So we should always need to not limit ourselves to looking at those in the teaching hospital, because there's a lot more that's happening outside the teaching hospital. And of course, there's also international appeal and the ability to transition to other parts of the world. Like I said, pediatrics, sometimes you can go directly to the UK and practice, so there are different levels of appeal depending on the specialty. And the time starting about this is now. If you've not decided, please, from today, try to figure out if this is what you want to do and which specialty you would like to go into. So there are a few specialties. I'll just run through them. I think I wouldn't want to take too long. I think we're doing okay for time. So there are some what I'll term mainstream clinical, which is the surgery, which has different subspecialties: general surgery, urology, orthopedics, cardiothoracic surgery, plastic surgery, neurosurgery, and then internal medicine with all the subspecialties: cardiology, endocrinology, nephrology, neurology, pulmonology, gastroenterology, dermatology. There are lots of them, and then it's important to just know what choices you have. And then O&G, of course, that's one of the common ones as well, and then pediatrics. Then there are other clinical specialties like anesthesia, which has its advantages and disadvantages as well, ophthalmology, psychiatry, radiology, and the ENT that I just mentioned. And then there are the laboratory medicine, where we have the hematology, chemical pathology, microbiology, and histopathology. And of course, there is public health as well as one of the options. So now we'll go into the second option, which is some people just go directly into public health. Now, the challenge is that it's hard to have public health as a plan A. And that's because it's generally difficult to get in. People keep asking, well, how do I, they apply, they don't even know where to start from, basically. Some just happen to know someone or get one kind of role or another. But on average, you cannot say, oh, I want to go to NGO. That's like the commonest thing in public health, NGO. I want to go to NGO. Lots of people want to go to NGO, but it's not easy to get in there. So it's always good to keep an eye out for opportunities. And what I'll say is that when they talk about having a network, I think let me just branch in that direction. People call this thing, they say networking, and I always tell people that networking is a journey. And networking is that from your primary school, the kind of relationships you make and maintain throughout your journey of life, that is the real networking as far as I'm concerned. Networking is not, oh, I see Aliko Dangote and I'm now trying to talk to him or get his number. He's not going to want to do anything for him because he doesn't know me. But his friend who he knew 30 years ago that gave a very good impression, when he becomes Dangote, he'll remember that, oh yes, that my friend does this. Let me hook him up with this thing or that thing. So networking is not trying to farms with people who have already made it in life. Networking to me is being a good person and maintaining good relationships throughout the course of your life. And then that's where you get the strong network from. And some of these networks are things that can help you, be in touch with opportunities. I don't think there's any job I've ever gotten without utilizing my network. Sometimes someone just tells you, oh, have you heard of this job? Someone just forwarded me, are you interested in this place? Or I heard there's an advert here, or, so it's not as if it's even runs to enter, but it's just information. Sometimes they'll say, oh, I'm looking for an obstetrician, and then say, oh, I know one, I know Chinedu. Let me call him and ask him whether he's interested, that kind of thing. So it's good to keep an eye out for opportunities. And then sometimes the volunteer role is a good start. So don't be worried. I remember one of my colleagues who, when we started residency and we were getting about 230,000, he was working for an NGO on a volunteer role on about maybe 80,000, 100,000. And it just looked like, why would you be collecting this small amount of money, for, instead of just coming to government work. But of course, after getting experience, because they value experience a lot. So after a year or two of experience, of course, his wage skyrocketed way beyond what we even imagined. And of course, in public health and in NGOs, it's quite lucrative, comparable with Japa, sometimes even more, because now a lot of the funding comes in dollars and then they pay like some kind of international grade. I think when I started working there, I was surprised. Like entry level is basically higher than what consultants are getting in a teaching hospital. So I was even surprised. Like I give people this amount of money. Like now wow, it was quite interesting to see. So then those who are risen to the top are really really cashing out much better than anybody is getting in the whole Japan thing. And of course, when you're spending little in the country, you just see you just don't have any financial problems anymore. Of course, there's always the risk of long-term job insecurity where you're still a medical officer, you have experience, but we know that now all the funders, Trump has been very vocal about it. Most of the countries are moving their money to security as compared to, grants and everything. So there's always that risk of, the opportunities not being as much or you losing out and then you now have to fall back to nothing, basically. It's important to know that you can still come into public health even after residency. So, like I said, there's always a possibility of having some flexibility. So there's also humanitarian health. So it's not just NGOs aren't just, of course, program implementation like things like where I work, SIDA or CHI or UNICEF. There's also like the popular ones and the administrative or policy opportunities like the WHO, United Nations, and then there's humanitarian health. I think the commonest is ICRC, that is the Red Cross and Red Crescent Society. And then we have Doctors Without Borders, that's also pretty popular. So so there's some desirables, that help in the public health space. One is a master's in public health, they like that. And importantly, if you're trying to rise to the top, a master's in business administration is very well sought after. So if you have that, that's like that helps you. I would probably say if you get in, when you get in, you should look at getting an MBA somewhere along the line if you want to rise to the top. So it's useful to have that as well. And of course, naturally, sometimes international degrees are considered superior to Nigerian, though they are a lot more expensive. So if you go to Harvard or Cambridge or Yale or London School of Tropical Hygiene and you do your MPH there, of course, when you're in the market, they'll rank you higher than I who has MPH from ABU Zaria. Of course, nothing wrong with ABU Zaria. It's a lovely school, but generally people tend to look at these international schools a little bit better. And of course, job experience is often considered above certification. So it's not just to gather certificates. You gather and you'll be looking for work and you'll not find anything ultimately. Now, what I call option 4, health policy and administration, is sometimes underrated, and this involves like working with the Ministry of Health, either the Federal Ministry of Health or the State Ministry of Health, or the primary healthcare boards, National Primary Healthcare Development Agency, State Primary Healthcare Boards. And also there's also opportunity in the MDCN. And there are certain perks in this job. So first of all, there is that job security. Then they're also rising up within the organization. And even though I don't understand the intricacies of it, I see that those in the ministry tend to collaborate very strongly with the public health and with a lot of the funders, and they tend to do quite well. So it's often an underrated area going to the ministry, but it has a bit of potential. And importantly, is often a party to global bodies like the World Health Organization or United Nations, because they would always want someone that has national experience working with the Ministry of Health. So there's a full pathway there. I've had colleagues that went to the ministry and then they got funding and went for masters abroad and then just transitioned to international organizations. And so it presents more opportunity than most people realize. And from the people I've met in the ministries, they're not doing badly at all. I mean, I don't know who is stealing money and who is making it legitimately, but what I see, they seem to be doing quite well. A lot of even the State Ministry of Health, I don't see people there that appear to be suffering in any way at all. The government work always has its own perks as well, so it's an option to consider. Now, some people, based on preferences, decide to join the armed forces. So as a medical doctor, there are opportunities there as well. Typically, we go through like the direct short service into the Nigerian Army, Navy, or Air Force. I also have a number of classmates. I think what my classmate is now what they call it, is it Commissioner for Police or Inspector General, something. He's number 2 in the police in, I think, Plateau State or so. I know we're just congratulating him some weeks back. And a number of people also go into the DSS as well. And of course, once you go in, you can rise up the ranks, internally. Because I know quite, and then, you don't enter at entry level, of course, as a doctor. So there's always that option based on preferences. And then all of them have the option to send you for residency as a supernumerary staff. What that means is that they are paying your salary and they tell you, oh, go to JUTS and do your residence for 6 years. When you finish, you come back. And then so there's always that option. Of course, I know that there is some degree of internal politics, and sometimes it might take you a few years before they are willing to send you for residency, but there's always that option as well. And then, I mean, for some people, just like that authority in society. If you're a military man or you're a soldier, at least police can stop harassing you on the road. You say esprit de corps or something, and you show them ID card. Or, some people just like that power that comes with being in the armed forces. Of course, there are also downside of the cadre system and some restrictions on movement, travel, marriage, and things like that. And of course, there are significant security issues in the country currently, and of course, being with the armed forces comes with its own security risk. I know people personally who disappeared after a raid and were just never found. So it's important to keep that at the back of our minds if we are trying to think in this direction. And then we always have the politicians. Those typically start from I guess in Bingham, that might be BOOMSA or something, Bingham University Medical Students Association. So there are always those that like politics. And of course, generally, politics can coexist with other pathways. You can be a resident doctor and decide to be involved in ARD politics, or consultant and be involved in MD camp politics or NAT politics or any of the different directions. I generally say that there are two common directions. There is direct or through the corners. Now, the direct political involvement is basically you finish medical school and you join a political party, or you join politics grassroots and you just try to rise up the ranks there, run for office. There are a lot of prominent doctors. I'm sure we're aware that people like Ngige is a doctor, Okowa is a doctor, isn't it? And we have a number of them. There are quite a number of doctors who went in the direction of politics, and of course they've thrived and they are financially buoyant in society and seem to be doing quite well. Then, of course, what is common is people, what I'll term going through the corners. So some get involved in SUG politics, residency politics like ARD, and then, of course, the NMA politics, MD Can, Sogon, and things of that sort. And then just to mention some desired endpoints. So because it's a function of, where is this taking me ultimately? So commonly, those who tend to go through the corners, sometimes where they land eventually, maybe something like CMD. Most people don't mind being CMD. It's quite an enjoyable place to be, and it has its perks as well. Then some end up being commissioners for health because, generally when they are involved in politics, they tend to be closer to the government and have those relationships, and then they can give them appointments. And then a lot of our ministers for health served as ARD NAD president at a point in time. I know people like Isaac Adewale, I think they did lots of politics in the health sector. And of course, direct political involvement, you can land as the governor. We've had a number of doctors that became governors. I don't know if you had any presidents. I don't think so. But of course, if you're in politics, of course, that is the party. Most of the governors are aiming for that as well. Of course, the chance of achieving this endpoint is slim, because of course not everyone is going to be a governor or a president. So trying to choose a pathway in politics is like trying to be a footballer. Many people will play, but very few will become Messi. So it's not like the easiest way to go to get to the top. Now, option 7, private practice, possibly the most lucrative. The author you see here is Dida. I think his name is Onu or so, an obstetrician and gynecologist, and he owns the entire building. He's doing very well. I mean, people are making a lot of money. I'm not sure, even for me, I say that what represents my best opportunity of making it big financially in the country is by setting up a private hospital, particularly when you understand healthcare as a business and not as a service. Because sometimes people set up hospitals and feel like, is patients, you're seeing patients, you're trying to help people or something of that sort, But I remember when I left Jos and went to Lagos, that was the first time I really experienced the business of healthcare. Because and they will tell you need to separate the practice of medicine from the business of healthcare. Business of healthcare can involve even having targets, having revenue plan, having a financial meetings, understanding patient satisfaction. There's what they call quality of care, patient waiting time. Understand that people want to live. People cannot come and spend the entire day in the hospital. People are working, and if you're targeting like the wealthy clientele, a lot of them are very busy people, and so their time is very valuable. So you need to be able to even run an efficient service system that they're able to efficiently offer care in a way that they feel satisfied and feel like you've done the best. So there's a whole, I think one of the programs that we're doing is even trying to help private facilities understand how to run their hospitals. A number of the hospitals I had witnessed in the first 10 years of my career had almost no clue how to run medicine as a business. They were just running like, I get patient, I can do my surgery, and I bill them some amount of money. But as a business, it's very, there's a whole different ball game. But at the same time, it can be very, very lucrative. Now, most of the time, private practice follows residency. It's not patients now no longer want to see a medical officer. They're just not interested. Everyone wants to see a specialist, wants to see a consultant. So it's becoming more and more popular, and so it's unlikely that you thrive in private practice if you're a medical officer. It's best to do a residency first, then open that. However, for those who have like resources, who have the billions somewhere somehow, you can just set up and you hire specialists to run it for you, and then you run your business. So if you have the resources, you can certainly set up even without doing a residence. But if you're trying to build from the bottom, it's probably better for you to complete your residency and then set up private practice. Like I said, it's possibly the most lucrative, even more lucrative than public health or NGOs, if you set up well. Now, there's some top earning specialties like O&G. I think they typically used to call us oil and gas, because O&G, every woman is your client, basically, because every woman will get pregnant, and those who do not get pregnant will come because they cannot get pregnant. So that's like, already have like 30 to 40% of the entire population, and they're not sick, isn't it? It's physiological. They're coming to you with physiological reasons. So there are so many patients that there is enough to go. And of course, we know that IVF is currently popular and quite lucrative, and so there's also that as well. Then there's nephrology that I've also seen being a very lucrative option, because things like dialysis and transplant are very strong for revenue generation, over a short period of time. I think I've witnessed people who have really exploded, with the proper nephrology practice. And of course, orthopedic surgery is another lucrative option. And then radiology, is very, having a diagnostic center and running is sometimes unseen, but there's a lot of revenue as well to make from there. Internal medicine and pediatrics are often tough to cash out from, because people don't want to pay for consultation. They can't imagine paying. If someone pay 100,000 for consultation, like, what are you going to tell me? So most of the time in internal medicine private practice, where people then try to see how they can mark up their medications or use lab tests and things like that to try to get an income, but it's hard to get income in private practice from just the knowledge that you have. Knowledge is valuable, but most of the time people don't appreciate it or understand why they should pay for it. And so there's that as well. I remember that I need to treat it like hospitality. It's not charity. You're not helping anybody. It's business. So if you have private practice, know that it's business. I need to be looking at sustaining your business and having a proper business model to make money from it. Because if you want to just help people, of course, you can work in the government or work anywhere else. But if you set up a practice, if you don't make money, it's going to fold up or you wouldn't grow, and you just end up very frustrated. So private practice is very lucrative, and it's important to understand it very well, before delving into it. And then there's always the option of academia. Remember, you could commence directly. That is, from medical school, you can go and start lecturing anatomy. You can do a master, you can do a PhD. There's physiology, there's embryology. There's also option of direct entry into research. So there's clinical research. Clinical research has a significant appeal. And you can do a master's in clinical research as a start point. It's also like public health, in the sense that the opportunities are a little more difficult to get into, but there's a lot that can happen there as well. But the commonest pathway is following residency. And of course, know that professorship is still the highest academic rank. And then, in society, what is the most recognized and the most renowned and the most prestigious is still being a professor. So that's like at the top of it. Even I wouldn't mind if I entered the academia to also have professor. It's nice to have, and it's like the top. That's the peak of the profession. And then it also has that satisfaction of supporting medical development and direction. I desire to teach, because just being able to pass down knowledge to the next generation is underrated. Like when Samuelson was speaking about someone who's on this call, our teachers are never forgotten, especially the ones that are nice to us. And it's a ripple effect. If you transfer knowledge, that knowledge is transferred. And for me, it feels like an everlasting thing where once you pass the knowledge down, it just keeps going and keeps going. And so you give that fulfillment. Also, you can shape the practice. So usually you can be like a postgraduate examiner, you can be in the colleges and trying to shape exactly what direction we are going towards. Those who decided to go towards the OSCEs towards patient-centered care, just shaping the field of medicine in the country is also quite fulfilling. And there are also financial perks as well, because there are opportunities for grants, in the international sponsorships, expert reviews, and as a professor, you tend to attract a lot more grants. There's a skill in grant application, and most of the principal investigators tend to be professors in some of these institutions. So even whilst being in the teaching hospital, there are people who are linked with research, and there's a lot to be made financially even from that. So it's always important to have an open mind about opportunities that exist, because they exist everywhere. But if you're closed-minded, just looking straight, you might miss all the opportunities that come before you. And then, of course, a common endpoint is being the vice chancellor of a university. I think that's typically where they end up after professorship, and they do vice chancellor, and then that's also some become CMD as well. That's like one of the big things that we see there. Now, I think we're getting towards the end. So now there's some emerging options. You can see on the right, you can see Aproko Doctor. His creativity, content creation, social media. He was making content, and now he's doing very well, isn't it? So, and of course, you have a number of people that come after him, but it's unlikely that anyone will do as well, because he has already carved that niche for himself. So important to think about creative ways you can, even within the medicine. And we know we're in the place of tech. There's an emerging role of AI and design and modeling. So, I think about 2 people have sent me AI apps for me to test and see whether I can make a diagnosis with it, or what kind of responses it's giving. So they are designing a lot of things in tech, and there are a lot of opportunities. There are a number of doctors who are working with tech companies still linked to medicine. There is telemedicine as well, which is also like a startup that some people have. And when you understand the health sector, you're better able to guide some of these pure tech people, or better able to establish yourself as well. Then there's also content creation. Aside social media influencing, there's also medical writing, there's health journalism, then there's entertainment and health. Now, we know that in Hollywood, for example, every medical series you see, in fact, every movie you see, the medicine in it tends to be accurate. In Nollywood, we see where people carry stethoscope and keep on the forehead or on the hand, and all those clumsy things that we laugh at. And that's because they don't seek experts when they are writing their scripts or when they are making their movies. Increasingly, as Hollywood is upgrading, we're going to start having more and more doctors that would be needed inside the industry to help with script reviews, medical reviews of movies, ads, even the news and music. So things just need to be as accurate as possible. And so likely there will be some emerging opportunities in the movie industry and the entertainment industry overall. I mean, if you think about Grey's Anatomy, of course, you know that there would have been a number of doctors that are writing, that are deeply involved, and of course, they will be paid very well. And it's not a side gig typically, because when they are making this series, they need you full time. So there's that as well. Then there's working with the pharmaceutical company, which we call Big Pharma. They tend to pay very well. They do lots of clinical research in pharmaceutical companies, and then, of course, doctors also serve as drug representatives around as well. Then there's health insurance, because the HMOs tend to employ doctors, and you can rise to the top there as well. Because, of course, they can't just pay for anything. If I make a diagnosis of malaria and I'm asking for CT scan, of course, the health insurance company cannot just pay for CT scan. At the same time, they don't know, a non-doctor will not know that, malaria does not need a CT scan. So they usually need to have doctors there to check that whatever claim patients are trying to make is valid medically and makes some sense. And of course, there's also law and medicine. There's medical malpractice consulting, which is likely to evolve as societies grow, where you're an expert opinion and you offer expert opinion. It's important to carve a niche for yourself. The first to establish will likely achieve the most. Like I said, think Aproko Doctor. And just like MMM, if you join late, you will likely struggle. So find that niche. Whoever is going to be like the great person in Hollywood as a doctor, maybe we don't even have any yet, but eventually there might be someone that they all know in Hollywood that this person can review your script and sit in your movies and direct properly and everything. So be creative and look at the different options that exist. Now, there are certain things that we should think about when we're trying to decide what direction we want to go. Of course, one is finance. Will this pay well long term? And remember, don't always think of the now, but think about what happens in the long run. How much money, where do I see myself in 10, 15, 20 years? And then how lucrative does that look? Then family is also very important, of course. Not the most important thing in life is family after all. So it's important to keep that at the back of our minds. Does it allow for work-life balance, like whatever decision you're making and all that? Then of course there's your mental health. I know that now, particularly the younger people, are not ready to be stressed out. So we always need to remember, can I handle the stress of this choice that I'm trying to make? Private practice is lucrative. It can also be stressful. You're paying salaries, patients are not coming, it's difficult. You're cracking your numbers. It can be very stressful. Part of why I did not go there, I when I see some MDs and I see their life, I'm like, oh, this person is too stressed out. I don't know, I don't care how much money he's making. I cannot, have take this level of stress in exchange for money. And then of course fulfillment. Does it align with my purpose in life? In the end, like I said, when you're 70 or when you're 80, when you're in your deathbed, would you look back and be satisfied with the choices that you made? And then, don't just think of tomorrow, think of 20 years' time when you're trying to evaluate your choices. And then I think I mentioned this earlier, always keep a strong network with your peers, your superiors, your juniors, because your paths will cross over and over again in life. So have good relationships, be a good person so that when people are speaking about you behind your back, they are saying something favorable because these things really matter. And the one formula I always say is that hard work plus persistence plus direction equals to success. No matter the pathway you choose, if you're persistent and you work hard and you're going somewhere, odds are you will be successful. I've seen it so many times. It's when you just are unable to make those decisions to move forward. It's not Success is not very often purely chance. When you say chance meets opportunity, so you need to find a direction I need to go with. I need to work really hard in that direction, and then you'll probably be successful. You might not be the richest person. I mean, I don't know what anyone even wants to be the richest person for, but you would be successful and you will be fairly comfortable. So I think I'll just share my own pathway, basically, my rationale. I finished medical school in 2010, and my decision to the stay versus leave, was decided before graduation, following consultations with the original Japa generation, both in and out. So I had lots of conversations with those who left, those who stayed, and then at that point, I decided that yes, I think for me, stay makes more sense. And then so I chose that, okay, I'm going to stay and I'll do residency. So I did house job from 2011 to 2012. I wrote my primaries doing house job. Um, I wrote it twice. So I wrote the first one in the first 3 months of house job, and I wrote the second one towards the end of house job. And so I passed it doing house job. And so that gave me a degree of comfort. What I used to tell myself then, I said, by the time I finish NYC, I want to have my primary. So I have 4 opportunities, 2 during house job, 2 during residence, so that no matter what, by the time I'm finishing residence, by the time I'm finishing NYC, I have my primary. Luckily, I got it in the second attempt. So that was it. But I knew that I wasn't going to finish NYC without having my primaries. And of course, my choice for O&G was, well, because it was very easy to understand, for me. It's just, I sometimes just calculate that it's just the uterus, whatever is there, remove it. If it's fibroid, remove it. If it's the baby, remove it, If it's too complex, just remove the whole uterus, Of course, pardon my chief, sir, it's not that simple. But I mean, I generally say that yes, one is pretty straightforward. And then outcomes were good. My our patients are not sick. I always say that during house job, when I was doing O&G posting, when I'm walking in the corridor, someone says, doctor, if I turn, I'll likely see a woman smiling. I will not recognize her, but I'll say, oh, madam, how are you doing? How is baby? They'll say, fine, oh, thank you so much for the other day. We bring so much joy compared to internal medicine. When I do internal medicine doing how job, if I'm working in the corridor, so someone says, doctor, I'll turn and I'll recognize the person because I would have been seeing him for like 8 weeks or 3 months. And because you see them so much, because they stay on the mission for so long. I say, oh, how is your mother? Or how is your father? Or how is your brother? Sometimes they say, oh, he's still there. Or sometimes they'll say, we lost him. Or looking for death certificate. It just, is the work they do is good, but I just didn't want to be surrounded by that degree of sadness. And so that was why I couldn't have gone for internal medicine. And I considered hematology, radiology, urology, and orthopedics, but I think by the end of final year, I was pretty much sold on O&G. Interestingly, I had a receipt in ONG, and I think it was during that receipt that I fell in love with it, because then all the Eficos in my class had left, and so there was space for those of us that were less intense. So there was space for us to pay attention and really hear. So I was like, oh wow, this specialty is very nice. So like I really enjoyed doing that during my receipt. So I think that was a nice experience for me. So I always say my favorite posting in medical school was my ONG receipt posting, because it was so nice. And then NYC were from 2015 to 2012 to 2013, and I did my residency from 2013 to 2020. First year was unaccredited at Benue State University Teaching Hospital, and I did 6 years, partly in Garki Hospital and partly in Jute. Got my national fellowship in October 2020 and my West African fellowship in April 2021. Then I moved into the private sector, where I had exposure to like the business of healthcare. I learned how to do IVF. Back at that point, a lot of people felt, you've learned IVF, there's plenty of money, just open your own. That's where you make money, things of that sort. But I wasn't exactly sold on that direction. So I eventually just left there. Then I moved to another hospital. I just practicing regular ONG. I spent about 2 years there before I then transitioned to public health, where currently I'm working as a maternal health specialist, where I support program implementation to ensure accuracy of implementing and support the government and donors to implement programs. It's an interesting job. Basically, I tell people that if you look at our maternal mortality rate in Nigeria, which is ridiculously high, I wouldn't imagine that doing it one woman at a time in the hospital will be able to solve the problem. So I said, let me attempt and see if I can do it 1,000 women at a time. So that was kind of what informed my decision to like, let me try out public health and see, what kind of impact we can make from a broader perspective. And I think I got my master's in public health this year. It was very enlightening and very interesting, because sometimes in the hospital we see patients and we just see, this woman has preeclampsia or she had PPH, but there's a whole scale of things. When we look at commodity availability, human resource for health, referral systems, it's very complex, and it gives a broader outlook as to how to solve problems than when you're in the hospitals, basically. So of course, if you trace 2010 to 2025, that's about 15 years. So I probably still have maybe 20, 25 years of practice left. So I don't know what the future holds for me. We'll see how it goes. For now, I'm in public health. It's okay. Financially is also quite nice as well. And then, one step at a time. But certainly, I think part of what even made me transition from private practice to public health was that I felt I was too young. It still felt stagnant. I always feel like I need to be going somewhere. So just working, how many CS do I want? How many myomectomy? How many hysterectomy? I felt like I wasn't going. If I was in the government hospital, maybe I'll be writing papers and be heading towards professor. But in private, there was just nowhere. I just felt stagnant. I said, I have to be moving forward somewhere. And so that sense of purpose now made me transition here. And at least now, clearly, I can see some degree of progress. And then we'll see how it goes and see what the future holds. So I think we are 5 minutes past 8 now. I will stop at this point and maybe stop sharing my screen so that I can take any possible questions. Thank you very much. Let me just stop sharing and see, look at the chat box. Okay, all right. So thank you. I think Samuelson, I'll hand back over to you if there are any questions or thoughts, or if we have anyone that wants to, if our teacher might want to chip in a little bit before we take more questions. Over, Samuelson, over to you.
Well, thank you so much, sir, for this extensive, wonderful presentation. It's really been very enlightening. If I were in church, I would have said I'm blessed by listening to your presentation. It's offered valuable practical insights to, different pathways in medicine, and different opportunities that one can take. And it was very eye-opening, and also I believe very, very thought-provoking. And it's usually beautiful to have someone that has walked the path give you some insights even from personal experiences. In fact, the presentation I'm sure has a lot of useful insight for doctors that are just beginning, and even doctors that have gone far in training. And I've gotten very useful insights from this. Thank you so much, sir, for making our time to be, to prepare your lecture, your slides, and to spend time with us. Thank you so much, sir. God bless you. I don't know if anyone has any questions, or maybe before we take questions, we have a very senior professor in our midst who has been part of the lecture from the beginning, and she expressed interest when she saw the adverts to be part of the lecture. Someone that is a teacher to many of us, Professor Amaka Ocheke, is here with us. And Mama, I don't know if you have any useful insights you want to add or just say something to us before we take questions. Thank you, ma.
Thank you, Samuelson. Chinedu, well done. Well done, Obikili. It's I learned a lot, and then some things were made more clearer or more practical. I don't even know what to say, but it was a good one. Well done. I'm very happy. I'm very happy, and I feel proud. Yeah. So not much to say anymore because I think he pointed out the reality of what is on ground, and I just liked the one of the things he also raised, that as a doctor you can do anything. So all those dreams that you've had, the things that you think people or medicine has kept you back from doing, you can do all of them. And then the good thing about it is you can sometimes do some of those things from a safety position, I think. Like if you have a job, which many times you would have a job, especially now the way things are, you would have a job and then you are trying things. So if you, for example, want to be an author, you have a job, you try your hands at writing while you train yourself, or you take trainings, or to be a writer, to be an actor if that's what you want to do, to be a playwright, to write movies, as Chinedu also pointed out to us. So I think it's, for me, it's a win-win situation, and that this thing of keeping an open mind and being willing to be flexible, that either way you can, you don't stay fixated on a particular way. And even when it's not working, I've seen people who have stayed in one position for years because they insisted that they must, this is the way they want to go, and it's not working. Try other things and see, maybe there are other things that are waiting for you, and you are just maybe at the wrong place or trying the wrong thing. So keep an open mind and try other things, and anything can work for you. I had a classmate, the best graduating student from my class in secondary school. She won all the prizes. The only prize somebody else won was a subject she wasn't offering, but any subject she offered, she was the best in everything. She was very good. Those people that's 300 and something in JAM, she went to Unilag, finished, and then she decided she wanted to go into accounting. So she went on to become a chartered accountant. She's a big woman in LNG today. She doesn't even put doctor in her name. It's only those of us who knew her in the earlier years of her life that know she's a doctor. She doesn't even mention it. She doesn't go by doctor anything, but she's a doctor. But she's carved a niche for herself in the oil sector through the accounting pathway. So, as he said, you can do anything. Don't limit yourself and think that it's only clinical medicine that you can do. There's so much out there that you can do if you open your heart, if you open your eyes, and you are willing to explore. There's so much you can do. And just to also say that you must think, towards the end of his presentation, he also talked about when you are old and you look back at your life, will there be any regrets? So you should also think of that when you're making the decisions that you need to make as you make career choices. Sometimes what you may settle for may not be something that seems to give you so much money, but you are happy with it. You like for me, yes, being a teacher doesn't give you so much money, but I think what I earn meets my needs. I've not had to beg anybody for anything, but I'm able to pay my bills. So that's okay for me. But I love the job that I do. I honestly love my job. I wake up Monday morning happy to go to work. And I know there are people who drag their feet and they are not happy. So whatever it is you do, let it be something that every day you wake up, you are happy to go do the job. You are satisfied with it. All the areas of your life, you are able to balance it, family and other things around you. It's not just about work or and making money, but having a balanced existence that you look back and then you are happy about what you have done, the impact you have made, and the change you have made in the little corner, your little corner of the world. So I think that's what I have to say. Obikili, well done. It was really good. I enjoyed your presentation. Thank you, Samuelson, for letting me talk.
Thank you so much, man. Thank you for bringing your own insight and advice and counsel. I'm sure that we've enjoyed um, the lecture and every other thing. I don't know if anyone has any question that they would like to ask. Now would be the time to ask a question so that our resource person can throw more light on any gray areas that you have. And so I'm going to leave the floor open for a few minutes for anybody that has a question. You can just unmute yourself and ask, and then we can take it up from there. Thank you.
Good evening, everyone. Hello, can you hear me? Hello.
Yes, we're hearing you. Go ahead, sir.
Okay. Good evening, everyone. My name is Nero Uche Onoha. Uh, I finished from Abia State University and currently in pharmaceutical world. Dr. Samuelson, I just want to appreciate you immensely. But before I proceed, Prof. Cheke, I greet you, ma. I remain very loyal. I took my time to listen in as much as I'm actually on the way in transit, but I took my time to listen carefully. This was actually a very lovely gathering. And my question is just very direct. I am in the pharmaceutical system and I've been contemplating, just like one of the speakers mentioned, I happen to be one of the persons that actually studied medicine simply because Momsi persuaded him to study medicine, not because I wanted to. But however, I am not actually regretting.
We
I
cannot
am
hear
not regretting medicine. Can you hear me, please?
We can hear you. We can hear you.
Okay. So I happen to be one of the guys that was persuaded to study medicine actually, and at some point I wanted to actually regret studying medicine. But at some point when I finished, graduated, you know, navigated myself into pharmaceuticals, I come to understand the joy of being a doctor. There is this thing about you, being so different from others, not because you are too special, but there's this thing about medicine. Medicine has a way of grinding you, bringing the best out of you, and you standing so different from others. And honestly, I've come to actually appreciate my mother as much as I'm not fully into medical practice, into clinical practice. But then I've come to appreciate my mother. But my question here is, if I should choose to practice medicine, if I choose to come back to clinical practice, and also still want to continue with my pharmaceutical work, because that's actually my dream activity per se. It's actually what I dreamed for. Like I had wanted to be a pharmacist because my mom converted me to become a medical doctor. So if I should want to go back to clinical practice, how possible is that? Would that be any form of understanding? This is actually my humble question. Thank you very much. Once again, thank you.
Okay, Dr. Obikili, please go ahead and answer.
Yeah, thank you, Samuel-san. Thank you, Dr. Nero, for sharing your story. I feel like there are different layers to it. So the first thing for the direct question, absolutely, you can still come back to clinical practice. You're a doctor, you're licensed, as long as you renew your license and your license to practice in the country, then you can return to clinical practice. You can also, if you want to specialize or whatever it is, you want to set up a hospital, it's all within your grasp. So it's a function of choice. If your passion is in the pharmaceuticals, then of course you can also look at how you can rise up in that direction and what kind of pathways exist there. Because from what you've described, I'm not sure, it doesn't feel like you have a strong desire to practice medicine aside just maybe wanting to do what you spend time, training on. So there's no, I cannot decide for you, but you just weigh the options. But you can't come back and practice medicine. But there's probably also a pathway around where you are that you can rise up on as well. Just like Professor Cheke said about her classmates. So people don't even know that they started in medicine. You could rise up the ranks. But importantly, what I would say is that don't stay in one place. I don't know how old you are or how long you've been practicing, but always try to be moving forward. If you're coming to clinical medicine, make sure you're trying to climb somewhere. And if you're staying in the pharmaceuticals, make sure you're trying to climb somewhere as well. Just don't stay stagnant. Just make sure you're moving somewhere. That would be my advice. And thank you once again for sharing.